Are you allowed to cheat on the low FODMAP diet? The answer might surprise you. Whether you're dealing with IBS, SIBO, IBD, or something in between, I can help you answer the question whether or not you can cheat and how much, and ultimately how to make the low FODMAP diet work best for you. I'd like to start us off by sharing that the information in this video is coming from two sources. I draw a lot of my information from Monash University, which is the place where they research FODMAPs. They research the low FODMAP diet, they do clinical trials, they are examining foods and trying to figure out what foods contain FODMAPs and which ones do not. They are the place for all FODMAP information. They even have courses for lay people and dietitians. They've got a great Instagram, they've got a great app. Any information about low FODMAP, I would highly, highly, highly recommend Monash University's resources. So I'm basing a lot of my information off of Monash and the way that they have developed the low FODMAP diet, the way that they recommend using this tool. And I'm also basing this off of my 10 years of clinical experience working with people who have IBS, SIBO, and IBD, and using this diet among other therapeutic diets and nutritional tools in my largely nutritional-based practice. So that being said, the question still arises, can you cheat on low FODMAP? And I want to start us off by not directly answering the question quite yet, because it's actually a relatively simple answer, but I want to frame what we're about to discuss a little bit more. Chances are, if I was a betting woman at least, according to a recent research article, about 66% of you who are embarking on low FODMAP diet or this restricted diet have probably done so because it is self-prescribed, meaning that a GI doctor or a dietitian is not necessarily recommending this diet. You have found it because you are on YouTube or Google or Facebook groups or Reddit threads, and you are researching it probably now before you implement it in order to learn about it and navigate this process by yourself. So that is one thing to know, is that a lot of you are watching this video and you don't have the guidance of a dietitian or somebody who is properly trained in using this tool. And just like any other tool, it does require some degree of training. You can misuse it, you can use it incorrectly, it could do harm if you're not careful. It has longer term use of the low FODMAP diet has been linked with microbiome changes that are not good. It has been linked with lower fiber intake, lower calcium intake, lower vitamin B1, thiamine intake. So you really need to be quite careful when you're embarking on this degree of dietary restriction. The best thing I can recommend to you at this stage is to seek out a Monash trained RD. If you go on Monash University's website, there's a registered dietitian finder, and that's going to list any dietitian who has gone through and graduated from their course. Now, there are other people who have done it, like I've done that course and I passed all the quizzes and I have the certificate, but because I'm not a registered dietitian, I'm not listed on their website. But nonetheless, that's going to give you a pretty good bank of people who have gone through the Monash training and they know what they're doing with this diet. They know the pitfalls, what to watch out for, and what to expect. If, however, that is unobtainable, if you can't afford to work with somebody and you're just looking for free information, let's get on with the rest of the video because, again, I think that there's a relatively simple answer to this question. So when you're doing low FODMAP, the way that Monash recommends doing this is that you do phase 1, the elimination part of the diet, the part of the diet that most people call the low FODMAP diet. They kind of ignore phase 2 and phase 3, to be honest. The low FODMAP diet, as we typically think of it, is only recommended for 2 to 6 weeks. This is a very temporary diet. Monash is crystal clear. This is 2 to 6 weeks. Most people who get symptomatic resolution or symptomatic improvement see an improvement within like 2 to 4 weeks. So 2 to 6 is a reasonable window to keep an eye out for this. If you have symptomatic improvement in that time, which is going to be about 3/4 of people with IBS. Very few people find that low FODMAP completely resolves their IBS symptoms, to be clear, but there are shades of gray between 0% improvement and 100% improvement, and about 3/4 of people land somewhere in the middle of that spectrum. So if you had some degree of clinical improvement, you're feeling a bit better or a lot better, that is when the next step is initiated. And they say, all right, let's get into phase 2, which is where you trial individual foods and you kind of dip your toe in the water and you figure out what you can tolerate and what you can't, what you can get away with and what you can't. Now, I share this also because a lot of you have probably been on low FODMAP for much longer than 2 to 6 weeks. Many of the people that I work with have been on low FODMAP for months, if not years, and oftentimes I see this done mostly in the SIBO space. The people who have gone through the Monash dietetic route and they worked with a dietitian and they implemented it for IBS and symptom management usually are not the ones who wind up doing the strict version of this diet for a long time. The people who are stuck in that space is usually the folks who have been diagnosed with SIBO and they're told that this diet starves or kills or otherwise treats the SIBO. And that's the other big point that I want to point out. This diet does not treat the root cause of IBS. It does not treat SIBO. This is coming from, again, myself and my clinical experience, as well as Monash University. They are crystal clear. This is a symptom management tool. It is not a treatment for IBS or SIBO. I know that that's a very popular thought that's out in the SIBO space, that you can treat SIBO with this diet, but it does not appear to be true as of yet. At best, you're putting the bacteria into hibernation, and then the minute you eat these foods again, they're going to come right back and they're going to give you a hard time. So I don't want to get too off on a tangent about that. I did cover that topic in my last video about whether you could treat SIBO with diet alone. So go check that out in the last video. But going back, so from Monash, you're only supposed to do this diet for 2 to 6 weeks. Then you're supposed to be testing things out. You're supposed to be kind of cheating and trialing small and medium and large size portions of these high FODMAP foods. And you're supposed to be customizing the diet to you so that it is the least restrictive, the most enjoyable, but also helps manage your symptoms. Again, this is coming from Monash. This is crystal clear in all of their materials. I will share too that you don't necessarily have to eliminate all of the FODMAP foods to get symptomatic improvement. They even advocate very heavily in their course that you could do what they call a simplified approach to the low FODMAP diet. They recommend this for people who are at risk of over-restricting, so people who have a history of disordered eating. They recommend this for people who can't or won't comply with a restricted diet. And they give examples like people who travel a ton and they have to eat at restaurants and airports all the time, and they simply cannot meal prep to the degree that would be necessary, or people who have cognitive impairment and they can't plan and think through the whole process of that degree of restriction and food prep. Or this could be recommended for people who only have mild symptoms and they don't have horrible diarrhea and horrible pain. They just have a little bit of bloating and they wonder if cutting out a few foods would help. And then this variation of the diet, rather than cutting out everything with FODMAPs, so no apples, no onions, no mushrooms, no garlic, no avocado. I mean, honestly, it's all the foods back here on my wall. Rather than cutting out all of those foods, you only cut out the foods that are most high in FODMAP. So things like onion, garlic, wheat, and like beans and pulses. You could eliminate things that are frequently consumed that are high FODMAP just to see if those are a constant irritant for you. Like if you were a person who ate an avocado every single day, maybe try dropping that out for a little while and seeing how you do, because it could be that that's just a chronic trigger for you and you didn't realize it. They also recommend eliminating anything that you're particularly suspicious of. So if you are embarking on this modified or simplified version of low FODMAP, let's say that you are not at all suspicious of cauliflower. You could do cauliflower pizza and cauliflower rice like a friggin' champion. You are not suspicious of it at all. But you know for sure when you have high lactose dairy, it upsets your tummy. Or let's say you do not suspect onion and garlic and wheat whatsoever, but you're a bit suspicious of mushrooms and cauliflower and things with the polyols in them. So you could also approach it that way. But the point is that Monash gives you this wonderful array of choices, from a very strict low FODMAP diet for people who are highly symptomatic and really need a lot of resolution, to a simplified approach where you're only eliminating 2, 3, 4, 5 foods and it's very manageable. And they're very, very clear in their instruction that you're only supposed to do this for 2 to 6 weeks. So all of that being said, to actually answer the dang question that I proposed at the beginning of this video, can you cheat? Yes, you can. In my opinion, the best way to describe this or to answer this question is that it depends on your symptomology, how much symptom you get when you eat something, and what you're willing to put up with. Because again, this diet does not treat SIBO, it does not treat IBD, it does not treat IBS, it is managing symptoms for you. So if there is a low amount of symptom that you're willing to put up with, that's up to you, man. Like, that's fine. If you are willing to put up with a high degree of symptoms once a year because you really, really want your Nana's peach cobbler, that's fine. Do you, man. Like, I don't think it's going to do a tremendous amount of long-term damage, even if you do have a bit of a flare-up from it. The nice thing about FODMAPs is that their effect on the body is relatively short-lived. You're going to feel like crap. If you do feel bad, you're going to feel like crap for probably a couple of hours, and then it's largely going to subside. And that's kind of up to you, what you're willing to tolerate. Again, it's a symptomatic management tool. It's not the end-all be-all. It's not the treatment. So you can go ahead and make up your mind how much symptomology you're willing to put up with. You can manage the symptoms to a degree that is reasonable and effective for you and makes you happy and makes your life worth living. And then anything beyond that, you can play with it. And really, that's the best thing you could do with this diet. You don't want to be stuck on the super restricted version of the diet for the rest of your life. Nobody does. Play with it and see, because I'll tell you too, your ability to tolerate foods can and will change as the weeks and months and years pass, just organically, even if you aren't treating the condition. I'm telling you that right now. Your body can either get revved up or calm down. It can change, things can change, your gut can change, your microbiome can change. There's so many variables at play, and your body is different than it used to be, and it's different from what it's going to be a month from now. So continue to occasionally try foods and see what happens, and see if you can kind of dip your toe in the water, sense whether or not you're tolerating the food, and see, you might just get it back into your diet. One final plea in this video is for those of you who are trying to treat SIBO with the low FODMAP diet or another SIBO diet. The thing that I would suggest to you, again, going back to everything I just said and in the last video, this is not treating SIBO, but if it's helping you manage symptoms, you could still implement it to some degree. I think that the thing to know is that if you need a symptom band-aid to manage your SIBO symptoms, that means it's still there, and you need to go back and really reassess the SIBO treatment, not necessarily the antimicrobials and the antibiotics, mind you, but you need to go back and look at the foundations of SIBO. So do I have good motility? Do I have good stomach acid? Do I have good bile flow? Is there anything impeding my gut-brain axis, like poor sleep or stress or lack of movement? Do I have adequate nutrition to build a healthy human body? Do I have adequate nutrition to run my motility and make enzymes and stomach acid? Things like thiamine and zinc and iron, these are all really important for these functions, and a lot of you are deficient in at least one of those things. So you need to go back to what Amy and I call the unsexy basics, the unglamorous foundational tools, and really reassess your SIBO protocol from that lens. Luckily, we have tons of episodes on the IBS Freedom podcast for you about IBS, SIBO, food reintroduction, nutritional strategy, everything you could possibly need. I feel like we have a lot of episodes that are still in the pipeline that we're going to produce, and we have lists upon lists of topics that we want to cover. But I also feel like at 100-something episodes already, we have something for everybody, something that will help you no matter what stage of the game you're at, no matter where you're at in your healing journey. I really think we're going to help you with the episodes that we've already produced and certainly the stuff on this channel. So I think that's about where I'd like to wrap up. Again, we're not treating conditions with low FODMAP. It can be helpful, but by all means, cheat, go forth, have your Nana's peach cobbler, have a little bit of garlic, don't sweat it. Every now and then it's okay to dip your toe in the water and see if you tolerate a new food, because you might be pleasantly surprised to find out that you do. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.